Hello and welcome to the 5 Rights of Medication Administration, a call for systematic change. My name is David Woodruff. I'm the editor of Critical Care Nursing Made Incredibly Easy. I hope to make this incredibly easy for you too. So let's talk about why we look at the 5 rights. The 5 rights of medication administration are right patient, right medication, right dose, right time. Okay, so we all know those components that we use to help to provide patient safety when administering medications. However, this is putting all of the medication administration responsibility on the nurse. And as you can probably see already, just by looking at these 5 rights, there are possibilities for problems to occur, and often do occur, which then oftentimes end up with some bad outcomes. So let's talk about the difference here between using systems and people as our outcomes. When we are looking at just the people who are administering the medication versus the systems that we use for providing the medications. If you think about air traffic and you think about flying didn't used to be as safe as it is today. We used to look at all the crashes that occurred and blamed it on the pilot. Pilot error, pilot did this, etc. And over the years, we started to recognize that there are systems that can be put in place to help to prevent crashes. And as these systems were put in place, more and more air travel became safer. And as you may know, before they can even take off, the pilots have to go through a checklist every single time they fly the plane. Very redundant, but it's every single time they fly the plane. In this way, they make sure that they have dotted all their I's, crossed all their T's, made sure that all of those things are in order before that plane takes off. When we're over-relying on the 5 rights, we're looking at our desired outcomes and not maybe actionable procedures. There's a lack of specific guidance for our healthcare environment. It places undue burden on individual practitioners. So you probably feel this already. And if we look at ISMP's hierarchy of effectiveness, we'll see that in just a moment, this is a low leverage strategy for being able to prevent medication errors. So here is the ISMP, the Institute for Safe Medical Practices, their hierarchy of systems and human reliability to help to provide better and more effective care for our patients. So at the bottom levels here, you can see the least effective, easiest to implement. Let's blame it on the caregivers, right? Rules and policies, educational programs. All right, so somebody made a medication error. Let's do an educational program, and hopefully we will teach them not to do it again, right? Or suggestions. Be more careful next time, right? Well, one of the things we can do, kind of a medium leverage, is we can start to implement some warnings, some alerts, some redundancies, standardization, etc. But if we really want to create change that is going to be consistent and really help to prevent medication errors, we have to be looking at barriers and fail-safes, automation and computerization, and forced functions. The shortcomings of the individual accountability piece, those low-level, low-leverage type strategies, are that we have systematic blindness. So there's a blindness to the systems that are causing the errors. We're ignoring some of the human factors that come into play with different people, different understandings, different training, different experiences. There's a false sense of security. Okay, well, we did a training session, so everything should be fine. And there's this misplaced responsibility that the entire responsibility for medication administration falls upon the nurse, who also has a million other things to do at the same time. So the call for systematic change is going to be looking at these top components, implementing those high leverage strategies, adopting a more collaborative approach to how we're going to be doing medication administration, continuous monitoring and improvement. What isn't working? Let's fix it. Reform our education and integrate some human factors so that we can understand that there's going to be differences between caregivers and that we have to account for that in the systems that we implement. So the recommendations from the Institute for Safe Medication Practices are the 5 rights are insufficient as a comprehensive safety strategy. Good starting point, good educational tool for students, but we need to evolve beyond this simplistic approach and embrace a more holistic, system-oriented perspective, using high-leverage strategies, collaboration, and continuous quality improvement. That way we can create safer medication use systems. Thanks for joining me for the 5 Rights of Medication Administration, a call for systematic change. My name is David Woodruff, and until next time,